moderator Kevin Ogle, along with Mike Turpin and Kirk Humphreys.
What does that mean for you? If he gets his plan all the way through, what does that mean for you and your family and your health care and your insurance and your doctors? When we come back on Flashpoint.
He's trying to make us behave.
Yes, I'm trying. Stan Hupfeld will be here. Stan is the president of Integris Health. We're going to get to the bottom of this, what it means for you, coming up next.
And his son-in-law's with him. We're going to hear about the family.
We are back on Flashpoint. Our guest is Stan Hupfeld. Stan, of course, is the president of Integris Health here in Oklahoma. A very aggressive marketing campaign on the part of Integris, as well as Stan gets involved in a lot of community events, and that's probably where you have seen him before. But we're going to talk to him today about this issue of health care reform. And have you plugged yourself all the way into the Obama thing? Do you understand exactly what he's trying to do? Because it is such a massive, complex idea.
Now, I have a pretty good idea.
And what do you think?
Well, first off, there are some issues that have to be solved. We in healthcare are on an unsustainable glide path. So we have to change some things. And I think you have to start with at least a basic understanding of what the administration's trying to do. You have to start with the fact that, for instance, in the administration's belief, somewhere between 30 and 50% of everything that's done for the American public in healthcare is unnecessary.
Overtreatment?
Overtreatment.
Now, do you agree with that, Stan?
I think there's some number out there.
There's some number.
Whether 30, 50%. And, of course, if you believe that, then if you can find out what that 50% is and eliminate it, then you go a long way to paying for your plan. We've got, in their judgment, we have somewhere between 50 and 20% administrative cost, because every doctor, every hospital has an army of people that do nothing but collect bills. You eliminate that, that's a savings. In health information, if you could snap your fingers and put everybody on an automated record, there's another 10 to 15% savings. So in the administration's mindset, if you could cure all those problems, you in effect pay for what is done. The problem is, as the CBO tells us, that's really hard to measure.
That's Congressional Budget Office.
That's correct.
What they came out with a report this week. What did they say?
Well, they can't score. They have a very difficult time scoring it, and what you show are some huge deficits that you run up. Here's what I think is being missed in all of this. I don't think people have a relatively good understanding of what it's going to mean to their personal health care as we move into this. I think if you ask the average American, do you want to cover the uninsured? The answer is clearly yes. Do we want to control health care costs? The answer is clearly yes. But then you got to leap into what we're going to do. And frankly, here's where I think the president is a touch bit disingenuous. When he says, if you like your doctor, you can keep your doctor. If you like your insurance plan, you can keep your insurance plan. Because if you follow the logic tree of what's being proposed, both by Kennedy and Senator Baucus, who are the two main proponents in the Senate, is that you have to think that ultimately you do away with employer-based insurance.
Why?
Here's the reason. Number one, if you begin to tax health benefits, we all of us that work for someone have health care benefits. Most of us do. And those benefits are a tax-free benefit. And if you begin to tax those, all of a sudden...
And he's proposing to tax those.
If you tax that benefit...
Nobody believes that's going to happen, but go ahead.
A health-free benefit, now, people are going to say, well, now, wait a minute, I pay a lot every month for my... But your employer, for instance, health plan.
Integris Health,
right.
We pay 75% of our employees' premium. The employee pays 25%. You
don't want to pay taxes on that.
That 75% that we pay is a tax-free benefit.
Right.
And the theory is that you ought to tax that benefit. It's like any other benefit. It's like pay. Number two is that most insurance for the employer is tax deductible. So if you begin to tax the benefit and you eliminate the tax deductibility for the employer,
you lose the incentive.
You lose the incentive to provide health insurance.
They're going to drop it. What they're going to do.
And then the third issue is that there will be what's called a pay or play. In other words, an employer either has to pay into a fund an amount equal to the cost of an insurance plan for each employee, or provide a plan of a certain level of sophistication. So if you're an employer, now all of a sudden you don't have the tax deductibility anymore. Your employees are being taxed, at least some of your employees, maybe your higher wage employees, are being taxed on the benefit. And you're saying, look, I can either keep all this expense in my human resource effort, or I can just pay into a plan and let my employees go deal with purchasing their own plan. Why would I not do it? It's the same money to me.
Stan, the Congressional Budget Office this week told Senator Kennedy that if they adopt the Kennedy-Obama plan, that it'll cut uninsured by about a third. Right now they claim there's 46 million uninsured people in the country. It would reduce it by 15 to 17 million. But the cost for a family of four would start off at about $30,000 a year and wind up at about $50,000 a year. Does that make sense?
Well,
$50,000 a year for one family of four?
Well, what the problem is that what we haven't done, in my judgment, we haven't defined what it is we're going to pay for. It's pretty easy to say we're going to have insurance coverage for everyone. The question is,
what does it pay for?
What do you mean by that? And that is a very tough political argument that has not begun to be addressed.
And what's your read on how that works out at the end of the day?
Well, my read is that you're going to have some group that decides that. But you just look at our own state. Look what happens every time the legislature meets. We debate about what ought to be in people's insurance plans because a group of people, this last one, was on autism, and whether or not you believe that autism ought to be paid for, the fact of the matter is it becomes highly politicized. We're going to pay for X, we're not going to pay for Y.
Stan, let me a basic premise for the viewers. What is Medicaid? What is Medicare? They were both passed about 1965. I think most people believe Medicare is a good idea, even the Republicans that were against it back then. I think a lot of people believe Medicaid's a pretty good idea, but some people argue about that because they call it welfare. But what to you, the hospital, the doctor, the healthcare industry, do those two things mean? Medicaid and Medicare.
But Mike, we all agree they both cost a whole lot more than they told us they would back then. Which is what concerns
me. And they were based on some faulty economic principles.
But what is it?
Not the least of which is we were going to die a lot sooner than we really do.
Thank God for longevity.
Well, the Obama plan might fix that.
But just for the viewers, what are those two programs even?
Well, obviously Medicaid is a program for the poor.
Right.
And it's not for all poor. It's for certain portions of the poor. And Medicare is for the elderly. And by
elderly
definition,
meaning what age?
65.
65 or older.
And
Medicare.
That, of course, is increasing every year. You have
people
to be
living
older
longer.
And older. Right?
Yeah. Okay.
Well, you have to be older and older
to qualify
for now.
Right.
And eventually it'll be up 70 or plus. And it, by definition, is socialized medicine.
Yeah.
Because it is.
Oh, wait a minute. You said it.
I know.
That's socialism already?
No. What I said is if you define socialized medicine by that the government is the payer, they decide what to pay, when to pay, and who to pay, and how much to pay. That is Medicare. And so we've already got it. And as Kirk says, it's a pretty popular program.
Yeah. So why is it so shocking to extend it? Let's talk about it when we come back from the break.
We are going to talk about that, and we also want to talk about some people claim, and we'll let Stan address this, I'm not saying it happens at your hospitals, that Medicaid patients get rushed out of the hospital after they've been treated because the pay from Medicaid doesn't go as far as private insurers or Medicare. Does that happen? Will the Obama plan fix that? And is there a money issue at stake here for hospitals, doctors, and insurance companies? We'll be right back on Flashpoint.
You bet there is.
Back on Flashpoint, our guest is Stan Hupfeld, the president of Integris Health here in Oklahoma, a very successful entity. We're talking about the president and his health care reform issue. What does it mean for you? What does it mean for hospitals? Before we go any further, you may have noticed Stan's orange tie.
Tennessee Volunteers.
OSU Cowboy?
Not exactly.
What is it?
University of Texas.
And you've got a national championship ring there. Stan got that when he played for the Longhorns in 1963.
For a great Oklahoman.
And
when you could be small and slow and play football.
Darryl Royal was from where?
Hollis.
Got it. Who's the family here with you today?
My son-in-law's here.
And what's his name?
His name is Patrick.
And he's married to who?
He's not married to my daughter, Kate.
Okay. There's enough family stuff. Let's get back to the issue.
Keeping an eye on the son-in-law.
There's too much family values.
All right, very good. We're talking about health care, and I can already hear the rant flash mail right now. That the hospitals and the doctors and the insurance companies are against this because it's going to cost them money. How do you address that issue?
You're going to lose profit.
Well, actually, if you look at the hospital field and the hospital association, it has for many, many years been very focused and very supportive of covering the uninsured. And very focused on, the motto is coverage for all, paid for by all. So the hospital field, and we personally have been very supportive of trying to cover the uninsured. The issue that I have, and in order for the president to pay for this, there are huge cuts coming to hospitals. And so, that causes us some angst because it looks to us like we're trying to pay for reform on the backs of hospitals. Having said that, we do recognize that some sacrifice on the part of hospitals is going to be necessary. It's just that we cannot afford to pay for everything. If you start with the fact that I mentioned before the break, that the assumption is that 30-50% of everything we do is unnecessary. You start with the assumption that we've got too much technology, we've got too many hospitals, and if a few of them go under, we've got too much capacity in the system, and so let's trim down the capacity. We in this country we have a wonderful system that if you need an MRI or a CAT scan, you can get it this afternoon. If you need heart surgery, you can get it in the morning. And that's not the way it works in other countries, because the technology is much more confined because the capital dollars are not there. So what I don't think people have an appreciation of is how things will have to change in order to do what the president wants to do.
Talk about overtreatment.
Availability and quality is what you're saying, really.
Availability and quality.
Certainly. Well, I think everything in healthcare can be better. And the whole purpose and things I know that we at Integris are trying to do is trying to do better today than what we did yesterday.
What does overtreatment mean?
But overtreatment means, there's huge variation in what happens to people. Mm-hmm. If you look at what Medicare pays for and you divide the country up, what you will find with relatively the same demographics is that in one part of the country there's 2 or 3 times the surgery rates as there are in other parts of the country. Mm-hmm. And a lot of that has to do with the availability of technology, as I was trying to say. We have this wonderful system that technology is instantaneously available. Mm-hmm. And that's not true in the rest of the world. But we pay a great price for that. And that's what I think people are going to have to begin to have an appreciation of. If the assumption is that we've got too much technology, too many hospitals, too diversely located, and we've got to trim all that back, what that ultimately means, it does impact access. It does impact waiting times. And that's what I think people don't realize. The way we treat our aged parents is another issue. My father-in-law at age 85 got a total prostatectomy. Now, his life expectancy was the same with or without the surgery. That would not be an issue in any other part of the world. It wouldn't happen. It wouldn't even be a discussion.
You wouldn't do it.
Here it's a discussion because A, people are separated from the economic consequences of their decision. Mm-hmm. And B, that's what we do.
What I would compare it to, I talk to people that have military health care or Indian health care. Mm-hmm. It's available. It's free, but they have long waiting lines.
What percentage of people without any insurance at all show up at your emergency room?
And not only that, but before we went to the break, we said, is it true that Medicaid patients get rushed out of the hospital after their surgery because their plan doesn't pay as much?
No, I do not think that's true. Our Medicaid patients, just like our uninsured, or the caregivers, the nurses and the technicians and everybody in the hospital, they don't know what the payment status is of those. They're there to do what they do. And you could not find by diagnosis, you could not find a difference between the way people are
Medicaid, Medicare, private insurance, no insurance at all. Okay. What's the percentage roughly of the people that show up at your emergency room saying, I need help, I need treatment, that are uninsured?
We've got about a minute left.
It depends. It depends on the geography. Obviously, we have some hospitals that
How many hospitals you have?
14.
All over the state.
Yeah. All over the state, but roughly?
Roughly, probably 20%.
That's what I thought, 20%. Yeah. So why don't we want those 20% to be insured some way, somehow, so they can pay your hospital and your doctors?
Well, the problem for us is that if you assume that all of a sudden those people come in with a source of payment, which they don't have now, we give away,
right?
That's a plus. The negative for us is that if everybody starts to pay us what Medicare pays us, because we take a loss on Medicare and Medicaid.
80%?
Yeah.
Yeah.
So once you add all the numbers up, it's going to be rather devastating for hospitals. What that means is you know, the kinds of things that we've been able to do are going to be different, and it will begin to look more like an English or Canadian system. That's probably very good on the primary care, but as we get into specialty care, I think you can expect to see longer lines.
We have run out of time with our guest, Stan Hupfeld, the president of Integris Health here in Oklahoma. As you heard, 14 hospitals all around the state. We'll continue to gauge your opinion and let you weigh in on this and address the issues as the plan goes from the president to Congress.
Well, I hope the president runs out of time on this.
Well, that's going to be out of committee, the health committee, by the end of June, they're saying. Fair enough.
We'll see what happens. Speaking of presidents, one of our Flashpoint gang had his picture taken with one recently, right here in Oklahoma City. We'll show you when we come back.
The big man came to town.